Hello, I am Dr. MVR Shailaja, Consultant Obstetrician and Gynecologist at BirthRight by Rainbow Hospitals Visakhapatnam. Cesarean birth is a procedure where the birth of the baby is done by giving an incision on the abdominal wall and also on the uterine cavity. Though generally a very safe procedure, just like any other surgical procedures, cesarean section also carries the risk of complications. These complications depend upon whether the procedure is done as a elective procedure or a planned procedure or whether it was done as an emergency. So the complications usually depend upon the anesthesia related complications or the complications that arise as a result of the procedure per se, or the immediate post-operative complications or the complications in the baby. So usually whenever a cesarean section is done, they give a spinal anesthesia and drug is injected into the spinal cord which will make the lower limbs and abdomen numb. So if there is difficulty in this spinal anesthesia, then there is a chance of it getting converted into a general anesthesia. This is the first and foremost complication that one can expect during cesarean section. Usually whenever the stature is short or when the spinal cord have narrow spaces, then spinal anesthesia may be difficult. In such cases, usually they convert it into a general anesthesia. In general anesthesia, there is a risk of aspiration of the stomach contents if your stomach is not empty. So you have to be careful whenever an anesthesia is being given. See that you don't take solids for at least 6 hours and liquids for at least 4 hours. So these are the anesthesia related complications which may occur during the procedure. So the complications that may happen as a result of the procedure include the difficulty in the delivery of the baby. Suppose you are an obese patient having a thick pad of fat in your abdominal wall, then there is a chance of having a difficult delivery of the baby. And the second complication that may arise is excessive bleeding. Excessive bleeding may occur during the procedure. So this may even require further surgical steps. So a hemorrhage and difficulty in delivery of the baby are the most common complications that may occur during the procedure of cesarean section. So the complications that may arise in the baby at the time of procedure are, suppose the gestational age is not calculated properly and your dates are not calculated properly, there is always a chance of the baby being premature during cesarean section. And the second complication that may arise is that all the cesarean babies, there is always a chance of the baby having breathing problems because there is no proper stimulation. So these are the complications usually that are expected in the babies, that is a premature birth and breathing problems. And the third and most rarest complication is, there is, because it is a surgical procedure, there is a chance of surgical cuts on the skin of the baby. So these are the complications that may arise in the baby. And after the procedure, complications that can arise are infection. Because an incision is given on the abdominal wall, there is a chance of the wound getting infected. This infection can also happen within the uterine cavity and also the adjacent organs. So there is always a chance of injury to the adjacent organs. The adjacent organs are usually the urinary bladder and the bowels. So there is a chance of these organs getting injured and also the chance of these organs getting infected. So infection is one complication, and the second complication is there is also a risk of bleeding in the immediate post-operative period. This bleeding can be sometimes heavy bleeding needing blood transfusions also. The third complication that can arise in the immediate post-operative period is post-spinal dural headache. This is anesthesia related complication where the patient may suffer from severe headache. So in order to avoid this complication, the patient needs to take excess fluids during the post-operative period. And the dreaded complication in the immediate post-operative period is deep vein thrombosis. Deep vein thrombosis is a condition where there is a chance of a blood clot forming in the lower limbs. Usually immediately after surgery, the patient will not be mobile and will be in a sedentary state. So in that sedentary state, there is a chance of the blood getting clotted in the lower limbs, and this clot, if gets dislodged, it may cause serious complications. So the patients are usually advised to ambulate immediately after cesarean section so that they can avoid this complication of deep vein thrombosis. So once this period of immediate post-operative period is completed, there is always a chance of delayed complications also happening after cesarean section. These delayed complications can be in the form of delayed wound infection or delayed wound healing, and also there is a chance of adhesion formation within the uterine cavity. So these adhesions can form within the uterine cavity, and also some may even suffer from chronic pelvic pain. And also the another complication that can be expected at a late stage is placenta previa or placenta accreta. Because of cesarean section, the placenta may get adherent in the lower segment, and this may cause further complications in the next pregnancy. So whenever you go for a cesarean section, you always talk with your doctor, confirm the indication that they are doing for cesarean section, and also the alternative procedures if there are any available, and also the risks and complications that you may face during cesarean section. Thank you.